On the WPATH scandal now, Nick, in the Daily Mail, and the maggots keep wriggling out of this one.
Yeah, this is shocking. How influential trans health doctors and activists have secretly shaped NHS policies for more than a decade. So, as you say, this is WPATH, which the great Andrew Doyle is doing an entire show on Sunday. It's a topic the BBC doesn't seem to want to explore, but luckily GBNews is. And there's two things, really. One is how disgusting was WPATH and their guidance, and two, how much influence did they have over the NHS? So on the first question, they had an entire chapter on eunuchs and said that they should castrate or consider castrating anyone that identified as such. Can you imagine that? And then you look into it, there's a recording of a discussion about whether minors can really consent to this stuff. And a hormone specialist at one point says, look, these are people who haven't even had a biology class in high school yet. He says, I can talk to them about fertility preservation, but I'm essentially talking to a blank wall. But then he says this, he says, but still we want the kids to be happy in the moment, right? It's like, what? The sort of Rousseauian insanity of that. Yeah. That's the sickness at the heart of our society. Like, we know this is terrible, this will destroy children long term, but hey, we want them to have a subjective feeling of happiness now. Absolutely irresponsible, disgusting. So there's loads of stuff like this. There's other people who have things like post-traumatic stress disorder and schizoid typical traits, but then a doctor's saying to them, yeah, but they can still have hormones. It's like, can they? Are they in a position to be able to consent to that? Absolutely not. Yeah. So, or I would say not. So this kind of, and so it turned out that this has been very influential on the NHS and in their guidance. Now they claim, the NHS, that it has had no impact. It says, while we're aware of WPATH standards, we are clear that these do not determine NHS policy. So the ongoing question is, like, how much did it impact the NHS?
It's like, to a certain degree. Stonewall at the BBC or whatever, isn't it? The amount of soft power these people can have can be very decisive.
And certainly with the Tavistock, it was hugely influential. And in these leaks, they also pretty much admit to this being experimental treatments, whereas, the official line is like, no, we're science and evidence-based, as if it's all cut and dried and we know what we're doing. They don't at all. It's horrifying. This is going to be the next big medical scandal after, thalidomide and all the rest of it, the infected blood inquiry. We've sort of lost the ability to critically question and apply common sense to this. Obviously, giving puberty blockers, hormones, drugs and surgical maiming to children and adolescents that's something that should be done in a very extreme situation.
I mean, it almost makes me feel nostalgic for the days when we were giving antidepressants to kids. At least you were just thinking, well, they might get addicted and it might be difficult to get them off. But I mean, at least there was an exit strategy.
It makes electroshock therapy look chill, doesn't it? I mean, this is going to be looked back on as just a crazy time. People were taken over by this ideology and they did sick things. And some of these people should be treated like war criminals, in my opinion. We should look at it later and say, what were you thinking?
Yeah. Well, it is almost ridiculously evocative of Mengele, wasn't it? It's exactly the sort of thing that he would do to them. The eunuch thing as well, I mean, this is presumably adults as well you're talking about, but even that with adults, I don't feel comfortable about somebody being able, even at any age, to say, I identify as...
And if somebody wanted to remove their arm, they'd be sent for psychiatric evaluation and treatment and therapy. Yeah. You wouldn't be like, well, you identify as a one-armed person, let's whip your arm off.
Exactly. Extraordinary.